Welcome back. I'm Randy Patterson. In the last couple of videos, I've been talking about panic attacks and panic disorder. And in this video, I'm going to talk about how we treat panic. Do note, however, this isn't treatment itself. I'm not your therapist. And so this isn't therapy. All I'm doing is describing the nature of evidence-based treatment for panic in a very brief format that doesn't include a lot of the detail. So I'm just giving you the flavor of the thing. In other videos, I've mentioned that there are two main aspects to all of the anxiety disorders: anxiety and avoidance. The anxiety often feels like the worst part, so it's where most people want to focus their efforts. But that's the strange thing about anxiety. The more you try to get rid of it, the more of it you get. The other aspect is avoidance. And we avoid largely to manage the anxiety. If I can just get away from the things that provoke my anxiety, then my anxiety will go down. And this is actually true in the short term. But over time, avoidance tends to make us more prone to anxiety. So most treatments for anxiety focus more on the avoidance than on the anxiety itself. We try to identify exactly what's making a person anxious, and then we move slowly and steadily toward that situation. Now, panic disorder is a bit of a unique case. In most of the anxiety disorders, the person is avoiding some aspect of the external world, the external environment, heights, deep water, dogs, enclosed places, bunnies, you name it, right? But when I was speaking about the symptoms of panic, I pointed out that it tends to spiral based on our reaction to the symptoms themselves. So to a great extent, we're not reacting to the external world, but to our own experience. We're reacting to the symptoms. Now, for example, maybe we notice that our heart rate is going up, possibly because, well, we just ran up a set of stairs. We associate increased heart rate with the possibility of having a heart attack, like Uncle Walter did. So the sensation of our heartbeat becomes a cue to become more anxious. And the more anxious we get, the more our heart rate increases. So we have a kind of feed-forward mechanism in which changes in the body attract our attention, producing even more of the same changes. Now, in some cases, symptoms produce different symptoms. For example, if we breathe more shallowly and rapidly, our carbon dioxide level is likely to fall. When we breathe, we take in oxygen, but we also breathe out carbon dioxide. And carbon dioxide in the blood is partly responsible for maintaining our blood pH within normal limits. When we overbreathe, the pH rises, the blood becoming more basic. Now, you cannot detect that directly, but this produces dizziness and numbness or tingling in the extremities. And sometimes these other symptoms provoke even more anxiety, at least until you realize what's happening and that these changes are relatively harmless. So what do we do with panic? Well, one thing we often do is we train people to breathe using the diaphragm. Now, normally you breathe using mainly two sets of muscles. The intercostals link each rib to the one above. Now, breathing with the intercostals makes your chest move outward and slightly upward, like this. This type of breathing is usually relatively shallow and promotes a speeding up of respiration, at least if that's all you're doing. We can also breathe using the muscles of the diaphragm. which is a large sheet of tissue shaped like a parachute that divides your chest cavity from your abdominal cavity, completely cutting you in two. When the muscles of the diaphragm contract, the dome flattens out and lowers, pushing everything in your abdomen downward and outward. So, it's always easy to tell when you're breathing using the diaphragm. Your stomach will tend to stick out. So if you place your hand over your stomach and then breathe in deeply, you should feel your stomach expand like a beach ball. When we're under stress, though, the diaphragm tends to shut down, and we go from abdominal breathing to chest breathing. We breathe more rapidly and shallowly, and we breathe out more carbon dioxide than we need to, and our blood becomes more basic. And again, we develop more of the symptoms that we associate with panic. So in treatment, we train people how to breathe properly using their diaphragm. And when they notice themselves becoming more anxious, they can place a hand on their stomach and concentrate on breathing more deeply and more slowly. And this can help reduce the physical symptoms of panic and prevent some of that spiraling of anxiety. Now, there's just one problem with training people in relaxation strategies or breathing strategies for panic. We can give them the impression that the anxiety or the physical symptoms are dangerous and need to be controlled. In fact, they're not dangerous. They do not need to be controlled. They're just unpleasant. If we can give people a sense of mastery over at least some of these symptoms, maybe by breathing, they can become less threatening. But we don't want people thinking that they have to be dealt with or else something bad will happen to them. It won't, actually. So along with breathing training, we'll often do work on emotional acceptance, recognizing that you have had these sensations many times in the past and you have survived every single time. It can be a little bit like working out at the gym. Afterwards, some of your muscles may feel slightly painful. And if you've never experienced that before, you might think that there's something wrong. Eventually, you begin to realize this is a normal and non-threatening kind of pain. And then you accept it. That's what we want people to be able to do to at least some extent with the sensations of panic. Open up to them and allow them to be there. And there's another paradox. The more you can open up to these symptoms, the fewer of them you tend to get. The symptoms stop spiraling upward. Because you're not afraid of them, the fear doesn't ramp it up even more. So the spiral stops. One way of helping people come to terms with the innocuous nature of these symptoms is to bring them on deliberately. This is called interoceptive exposure training. We do things that will naturally bring about the symptoms that this person is most alarmed by. Now, initially, we do this at a mild level, and then we work our way up. Let me give you an example. Let's say that of all the symptoms you get during a panic attack, increases in your heart rate are the most alarming to you. So you've been avoiding anything that causes your heart rate to increase. Once you've had your medical check, and that's important, so we know that there isn't a real physical risk, the therapist and client might go to a stairwell and run up and down it several times. Now, usually the therapist will do these exposures right alongside the client. So we'll both get our heart rates up to the point that we can feel them. Now, initially, maybe we'll just do one flight of stairs, then two, then three, gradually increasing the intensity of the heart rate change. And after each time, we'll notice as the heart rate goes back down again after a little bit, and knowing that you can bring on the symptom and then allow it to go away can be very helpful. Because it's controllable, it's less scary. Another exercise is voluntary hyperventilation for the people that are worried about the breathing changes or that central high chest pain that they sometimes get, the tightness. What we might do is we might breathe together so that we expel more CO2 than we usually do. And our blood will become more basic, and we will begin experiencing symptoms like dizziness, lightheadedness, and paresthesias, tingling sensations in our hands or feet. And then we'll deliberately slow our breathing down a great deal, and we'll notice as those sensations go away. And then we will bring them back with more forced ventilation or hyperventilation, like for a minute or so. And then we'll make them go away again. And this will give the person a sense of control over those symptoms. Not so much that they control it every time it happens, that's not the point, but so that it isn't nearly as alarming when it does happen. Now, there are a lot of these kinds of exercises, and the ones we use depend on which symptoms cause the person to spiral upwards. If feeling like they're not getting enough air is the core symptom, we might have them actually breathe through a drinking straw for a little bit. And if you feel like you're really not getting enough air when you do that. Now, those are just a few of the strategies that we might use for a person who has panic attacks. The overall agenda is to intervene in the temptation to avoid challenging sensations or situations and to move toward them instead. But there's something I haven't talked about. What about the avoidance of external situations where the person is worried they might have a panic attack? What about fears of going into a grocery store or a theater or a sports stadium, or even of being alone for a period of time? What about all those safety behaviors that people engage in, like making sure that they have their cell phone, their anxiety medication, their water bottle, and everything else that makes them feel more secure? For these elements of treatment, I'll do another post that will focus on the agoraphobia side of panic. See you then. If you like videos on topics like this one, consider subscribing by pressing the subscribe button below. You can also take an online course of mine on diaphragmatic breathing by visiting psychologysalon.teachable.com. The course is called Breathing Made Easy.